Good afternoon, and for our viewers on the West Coast, good morning. Welcome to today's webcast, which I'm sure you'll find very informative as we share some of the key findings from our latest national consumer study. Before we get started, we have just a few housekeeping details. We encourage you to take full advantage of this interactive webcast by asking questions of the presenter via the question box, which is just to the right of the minimized viewing screen. Of course, if you wish to enlarge the screen, just click on the icon in the lower right corner of the viewing screen. Finally, we'll be making this webcast available for on-demand viewing. Simply go to prccustomresearch.com and click on the Events tab, and then click on Webcast on Demand on the drop-down menu. Then, choose the webcast and then enter the required information and watch the webcast at your leisure on the device of your choice. Please remember, if you view the webcast at a later date, you can still ask questions by using the question box. Those questions will be forwarded to Keith and myself, and we'll answer your questions via email. Now that we have the housekeeping details behind us, let us turn to today's presentation. Today, I'm happy to introduce Mr. Keith Schneider. Keith has a background in marketing and started with PRC as a project manager in 2002, focusing on consumer studies. In 2010, Keith began presenting findings of consumer studies to various clients, and this year was named the Associate Director of our new Consumer and Brand Division. In addition to being a content expert to our clients, Keith oversees our National Consumer Study, which is the topic of today's webcast. Keith, over to you.
Thanks, John. The PRC National Consumer Study has historically been a survey we conduct every other year, and for the foreseeable future, we will be conducting it annually. The survey consists of a random sample of 1,000 healthcare decision makers across the 48 mainland states and Washington, D.C. These 1,000 surveys yield a plus or minus 3.1% error rate at the 95% confidence level. PRC has a staff of professional interviewers specifically trained to conduct telephone surveys based around healthcare. As you can see, PRC works very hard to ensure the population is representative of the various demographics according to the U.S. Census, including age and race. Looking at some of the key findings from this year's survey, one of the first things we noticed was a decline in hospital preference over time. What could be causing this, and what are the implications of such a change? One thought could be that nearly 8 in 10 consumers feel that there's an acceptable amount of choice of hospitals. Between government-required measures for quality and each hospital's own desire to improve patient satisfaction, perceptions of quality of care are improving, leading to a greater feeling of choice for healthcare. As the gap between perceptions of quality narrow from facility to facility, the amount of choice increases, and you will also find an increase in the number of consumers who prefer a hospital that is also the easiest to reach from their home. In addition to seeing a drop in preference, we also notice a rather large increase in the awareness of local advertising. This shows the possibility of hospitals saturating their markets with advertising, but that advertising is not effectively shaping preferences and possibly just causing confusion in the marketplace. More than 90% of consumers say they have not taken any action as a result of any advertising they have seen. And more than 1/3 of consumers feel that hospital advertising is less useful than the advertising for other goods and services. This can be a direct result of so many hospitals saying the same thing and not differentiating themselves from their competition through strong branding. Focusing on the meaningful differentiation of one brand over another is what will set hospitals apart from their competition, leading to more preference for their enterprise. So why is this hospital preference so important? Effective branding for hospitals will not only create awareness of a brand, but can also lead to that preference, which in turn can lead to hospital utilization and loyalty. That loyalty also turns into word-of-mouth marketing and can greatly improve market share. There are several questions that highlight the importance of this hospital preference. For example, we found that 8 in 10 consumers with a preferred hospital have actually used that hospital in the past 2 years. Showing the loyalty those with the preferred hospital have, 98.2% of those using their preferred hospital say they would use that hospital again in the future if they needed healthcare services. Looking at how that translates to word of mouth, we found that 80% of those with a preferred hospital rated their likelihood to recommend that hospital as an 8 to a 10 using a 0 to 10 scale. Not only did they say they would recommend that hospital, but we found that 73.2% actually have recommended that preferred hospital to someone. In addition to directly recommending a hospital when someone needs care, they also talk about their experiences at a hospital, especially when they feel they got excellent care. We found that 84.1% of consumers with a preferred hospital have said nice things to someone about that preferred hospital. We also asked consumers if they would pay $50 more per month to keep their insurance, to keep their preferred hospital, or if they'd rather keep the less expensive insurance that does not include their preferred hospital. We found that nearly 70% said they would pay more to keep their preferred hospital. There are many questions out there about whether consumers are more loyal to a hospital or to their doctor, and while loyalty can be strong either way, we did ask respondents to tell us, what would you do if your doctor recommended a hospital other than your preferred hospital? We found that while half of respondents would just follow their doctor's recommendation, the other half would tell their doctor which hospital they actually prefer to go to. And when those who would tell their doctor which hospital they prefer were asked what they would do if that doctor still insisted to go to the recommended hospital, we can see 40.5% said they would change doctors so that they could use their preferred hospital. So while most people will end up following their doctor's recommendation, there is a decent sample of consumers out there who would go as far as to change doctors so they can use their preferred hospital if it came to that. Now, while we know consumers have loyalty to their doctor as well, you can see that nearly 1/3 of consumers have been with their current doctor less than 5 years, and about 65% 10 years or less. In addition, more than 1/3 use their doctor only 1 or 2 times per year, and 70% use their doctor less than 5 times per year. That isn't to say that it's not important to brand around doctors as well. Much like with preferred hospitals, we can see that of those with a regular doctor, nearly 90% have said nice things about their doctor to others. 81.6% of consumers say their likelihood to recommend their doctor is an 8 to a 10 on a 0 to 10 scale. And 71.6% of consumers actually have recommended their doctor to another. So when asked if they would spend $50 more per month for an insurance to keep their doctor, much like with a hospital preference, about 70% said that they would. So what does all this mean? It means that being the hospital consumers prefer in your market is extremely important. That preference leads to utilization and loyalty and word-of-mouth advertising. But you cannot grow your preference share by simply throwing ads out there, as it is likely that your competition is doing the same thing. You have to find your brand that sets you apart and focus on growing that in the minds of consumers. So what are some of the other key findings from the 2014 PRC National Consumer Study? Another major finding from this year's National Consumer Study is the effect the internet is having on healthcare decisions. When asked where they get most of their healthcare information on local doctors and hospitals, friends and relatives is still the main source. However, the internet, as you can see, has steadily increased each year and has supplanted family doctors as the second highest mention in 2014. When asked specifically if they would use the internet to obtain healthcare information, 61.9% said that they do, which is significantly higher than 2012. The question this brings up is what consumers are using the internet for. One thing that hospitals that we have talked to have been curious about is the effectiveness of the Hospital Compare website. Over time, awareness of the Hospital Compare website has slightly increased. However, the actual utilization of the website has declined. Now, how about the use of the internet for patient portals? We found that just over half of consumers are aware of the availability of online patient portals. And of those, only half actually use them. So overall, that's only about 25% of all consumers that are using online patient portals. So what are the consumers using the internet for in regards to healthcare? Well, nearly 90% of those that use the internet to obtain healthcare information are researching a diagnosis or condition. 79.2% are researching prescribed medications, and 70.9% are checking for symptoms. There is certainly a percentage that are researching quality of doctors or hospitals, but most are likely researching information using sites like WebMD or even just a Google search. We even found that nearly 2/3 of those using the internet will either try a treatment they found or discuss what they found with their doctor. Now, all this is just a sample of the information that can be found in the 2014 PRC National Consumer Study. You can visit our website, www.prccustomresearch.com/consumer, to download a full copy of the report. You can also visit with us to find out how PRC can help you get similar information for your own market through a market-specific consumer study. At this time, we will open it up to any questions on this data or any other questions about the PRC consumer and brand product.
Thanks, Keith. As we move into our live Q&A session, just a couple reminders. You can submit a question using the question box on the right side. Just go ahead and enter your question. We'll send it right here to my tablet, and we'll ask Keith to answer it live for us. This webcast will be available on demand. Probably just take about a day for us to get that all edited and ready to go. So probably sometime tomorrow or the next day, you could go to the website, go to Webcast Available on Demand, the Events tab, Webcast on Demand, and choose the live webcast, the on-demand webcast of your choice. Keith, looks like we do have some questions coming in already. Just a reminder, you can submit questions live as we go here. First one here, a question about sampling. How many surveys do I need to do locally to be statistically significant?
That is a very good question. First, I need to apologize. During the presentation, I did feel my voice starting to give out, and as you can tell, it actually has given out completely now. I'll do my best to answer all the questions as loudly as I can. As far as sampling, that question is a very common question that is asked, and what usually clients are asking is, what is the error rate that is an okay error rate to deal with? And the answer to that question is it really is up to that particular client on what they're okay with. We will obviously work with every client to look at various factors such as how many service areas do they want to break the data by, are there other demographics they want to pull data by, to determine if we need to do more surveys so that if they do that subsampling, each of those subsamples have enough completions as well. So there isn't any magic number. It's a good balance between trying to find what fits within the budget and what gives them a decent error rate that they can live with.
Great. Another one here. This is a question we get quite often. Can we compare ourselves to other hospitals in your database?
Yes, that is a common question. We actually don't create a database like we do with our patient satisfaction or some of our other study types. The reason for that is, again, there's a lot of factors that can play into the scores. An example that I often will give is you could have two hospitals that are right across the street from each other, and in reality, they could be perceived as exactly the same. And so if you were to do a study and they did the same type of study, they're probably going to get about 50% awareness and market share between each of them. But if Hospital A decides that they're going to do a 2-county area and Hospital B decides they're going to do a 5-county area, then the results that they're going to have are going to be very different. And it's things like that can affect any individual hospital scores. And so making it comparable for other hospitals to look at is very difficult. What we do instead is we use this national study for several of the questions we've gotten here as a benchmark for each of the hospitals so that they have something to compare to. But we generally don't compare to other hospitals in the database because it's too difficult to do that.
Okay. We're continuing to get questions in here. A reminder, if you would like to enter a question, there's a question box on the right side of your screen for those watching live. Even if you're watching this on demand at a later date, you can still enter those questions and they'll be sent to Keith and myself via email for us to respond to. Okay, question about breaking the national study results down further. Are you able to break down the national study results further to look at smaller geographies or segments?
To some degree. We only chose to do 1,000 surveys for this particular study because the main objective was to get a national score. So we wanted to make sure we had a representative sample at the national level. We did break it down into 4 regions throughout the U.S., and so we do have a good sample to be able to break it down at that level. We didn't do enough surveys to look at it at any individual state or even within their individual state, and that's why it's even that much more key for hospitals, if they're interested in learning about this in their own local market, to conduct a survey in their own specific market as well.
Here's one about methodology. On surveying the community, is the telephone still the best way to reach people? In this industry, we're seeing more and more, there's mail surveys, internet surveys.
Yeah.
Most of the surveys we do are on telephone. Is that still the best way to reach people?
It is still the best methodology. The question we get a lot has to do with cell phones. A lot of people are moving to a cell-only household, and people say that, if you called me on my cell, I wouldn't do the survey.
Sure.
But we actually do include cell phones in our sample, and we get quite a good participation overall. The main objective of the survey is to ensure that you have a representative sample of the population as a whole, and we watch very closely all the demographics to make sure that the sample we have is representative. Some of the other methodologies you referred to, such as the online surveys and paper surveys, the challenges that they have is that they are a self-selection model,
Okay.
and that will tend to cause the data to be skewed a little bit towards certain demographics, and then you have to rely a lot on weighting. We have done some analysis and have determined that scores can be quite different between a handout survey and a telephone survey, and we feel that with the representation of a telephone survey, that's the best route to go, and we still do get very good participation overall.
Okay, thank you. Here's another one. What kind of advertising do consumers recall most? TV, radio, newspaper, something else?
Generally, I would say they recall TV. Whenever we ask that question, we see TV as the main response. Now, that's not to say that television is the most important or that you should put all your eggs into the television basket, for example.
Well, budget's going to come into play there too, probably.
Yeah, and if you talk to any marketing expert or any ad agency, they'll tell you that typically a multi-methodology is the best for, or multimedia buy is the best for marketing, but you have to take into account what your target market is, what it is you're trying to promote, and so there's a lot of different things. And it also has to do with cost as well. Television is one of the most expensive as well, so is it more beneficial to do one television ad or to put up 20 billboards across your town? So there's a lot of factors that can play into that, and they really should rely on their marketing expert in their own area to determine what the best method of advertising is.
Got a few more questions coming in as I look here. Again, the question box just to the right of your screen. Feel free to type anything in there or come right to my tablet. Also, just to repeat, if you are watching this on demand, you can still submit questions. Keith and I will get those via email and respond to you just as soon as we can. Quality. When you ask about perceptions of quality in the National Consumer Study, did we ask how they define quality?
In this particular survey, we did not, but that is mainly because we needed to keep the survey. We had so much stuff we wanted to pack into the survey that we needed to be conscious of how long the survey was getting.
Sure.
But that's something that we can definitely do at the local level. So if a hospital wants to know how does their market define quality, that's definitely a question that you can add into your survey, and we can ask. We're fully customizable at the local level for each of our clients, and so we can definitely ask any question like that.
Outstanding. All right, here's an interesting one. The information you shared is helpful, and I don't think my market is much different. Why should I do a survey for my service area?
Yeah, it's funny. I think most people actually tell us that their market is very different as opposed to similar to what we see here. But I think that with this national survey, it is going to get at more broad questions. Things like, do you have a preferred hospital? As opposed to a local survey where you could say, who is your preferred hospital? You can determine, is it your hospital? Is it one of your competitors? And how close are you to your competitors? And so that's the big advantage of a local survey. You can get more specific to your specific area and ask questions about that.
Is your voice going to hold up much further?
I hope
You
so.
need to grab a
Couple
drink?
more questions, I think I'll be good.
All right. Here's one here. With only 8% of people saying they have taken action as a result of advertising, why should I advertise? How can I justify advertising to my CEO? And I'm sure this is a situation many of our marketing folks run into.
Yes, and we see both sides of it. We see the side where the CEO wants justification for doing marketing. We see other sides where the CEO thinks that marketing is going to fix everything if they have a bad perception. Bottom line is, the bottom line is you have to have your patient satisfaction scores up to par. If they're not, any marketing that you do is not going to work very well. People are going to come use you and then find out that the quality of care is not very good, and so your marketing isn't going to solve that problem. To answer that particular question, though, about why should you justify marketing, we talked about with that 8% how there's a saturation right now where there are so many hospitals that are throwing in advertising, and it's causing confusion in the marketplace. But what can happen is if you're not marketing, then your competitor is the only one marketing in your marketplace, and they are the ones that are going to start to grab some of that market share. What's really key is making sure that you do strategic marketing. Make sure that you are saying the right things, giving the right message. I just read an article that talked about how your marketing should be a story or be information delivered from the hospital as opposed to information about your hospital. Everybody's talking about their hospital, saying, we're the best for this, or we won awards for that. Where what can actually be beneficial is thinking outside the box and saying things like, breast cancer is one of the biggest causes of death for women of certain ages, and this message brought to you by this particular hospital, and that's a message that shows you can help them with that particular service. You don't have to necessarily say, we offer these services. So you have to think outside the box with the type of marketing you're doing. It's not like with consumer goods where people are going to see an ad and run out to the store. You're not going to have a 50% off coupon for a surgery or something. So you're not going to see immediate action off of an ad like you do with consumer goods, but advertising is still extremely important.
Well, I think I've heard you say before, if your competitors are advertising, sometimes you need to advertise just to, toe the line.
Yeah, exactly, because like I said, if you're not marketing and they're going to start grabbing that awareness and changing those perceptions, and meanwhile, you're not getting that. So a lot of times you have to look at, if you're measuring whether marketing is effective, you have to look at it as sometimes not moving at all is actually a win because you're preventing your competition from moving the line and increasing market share.
Looks like we have just a couple more here, unless any more come in live. You said that a large percent of people think that there is adequate choice of hospitals. Is there a difference in opinion when it comes to urban versus rural areas when it comes to
There can be. It really depends on the specific area. There obviously, in a lot of urban areas, there's generally going to be multiple hospitals, and so there's a lot of choice, as well as clinics and doctors' offices, etc. With the rural communities, it's going to be dependent. There could be a rural community where there's not another hospital for 200 miles, and they're the only hospital around. Then there's not as much choice. You could also have two hospitals in that same situation where there is adequate choice because there's two facilities. There's also a lot of rural communities that are only 20 minutes away from a major metropolitan area. And there's a lot of choice because people will say, it's okay, I can drive 20 minutes to get that particular care because I have that choice available to me. So it really depends on the specific region or market that we're talking about.
Okay. One last one, I think we'll give your voice a break. One last one. What comes first, preference or utilization?
Between those two, it would be utilization, but actually what comes first is awareness. Okay. So when you're marketing, what your marketing is going to affect most is top of mind awareness. So when you ask the question about what's the first hospital that comes to mind, that's the number you're going to see move the most based on marketing that you have just recently done. Over time, that's going to develop into perceptions of who is best for certain services. And then that's going to lead to people trying you and utilizing you. And if your quality of care is where it needs to be, that will turn to them preferring you and recommending you. So that's typically the order of things. And that's important to know because if there's expectations that you are going to run an ad today and affect your preference tomorrow, it's a long haul. Advertising is a process, and you have to affect the awareness first, start to change and shape those perceptions, and eventually will lead to preference.
So it's more of a process.
Yes, exactly.
Okay. Looks like we had one more come in. Can you handle it?
I can handle it.
And this one's actually for Mary. Will there be an archived version of this broadcast or report of the data presented? Great question. And we'll kind of close with this. Keith, thanks for all the information and for battling through the voice issues. Yes, all of our webcasts that we do, including this one, will be available on demand. Like I said earlier in the broadcast, it takes us a little bit to get everything edited and out on the computer, out on the servers, but this will be available. Give us about a day, maybe tomorrow or the next day at the latest. You'll be able to access this webcast and any of the others that we've done in the past. To do that, you just go to our corporate website. You go to the Events tab, and then there's a Webcast on Demand in the drop-down menu. Click on that. It'll bring up all the lists of webcasts we've done in the past. You can view those at your leisure on any device of your choice. Once again, Keith, thanks for all the information.
Right.
Thanks for joining us on this webcast. We'll continue to do these. If you have any requests for things you'd like to see, please feel free to send us those. We're always open for suggestions. If you have any questions that you wanted to ask or that we didn't get to today, you can always enter those questions using the box on the right and submit those to us. Like I said, we'll respond to those as we can via email, get back to you as soon as we can. Keith, thanks again. Thanks everybody for being with us. Have a great day.
Thanks.